Very hot summer and very humid Chennai, especially with the lockdown being extended and the corona looming over us like this great shadow. So all these things have put us under great difficulty, especially maids not coming, people standing for a long time in the kitchen without ACs, without fans, and cooking, trying to cook, right? So all these things have, and also our stress levels, and the whole world is under a period of chronic stress. So because of that, I've been seeing certain types of cases lately. That means it's I would even rather call it like lockdown special cases. Okay, so one such entity is sweat dermatitis. It means that you are sweating profusely, and you get allergic to your own sweat. It's because the sweat contains certain salts, okay, and these salts get deposited on your skin, and it causes something which is called maceration. Maceration means the topmost layer of the skin is getting eroded, and because of that erosion, your immune system is able to recognize all those components of the environment, as well as the atmosphere, as well as your clothing, or maybe detergent, be it whatever, any allergen. Once your skin gets macerated, it can recognize all those things very easily, and so you're getting allergic to, number one, your components of your own sweat, number two, those allergens to which you are usually not allergic to. So this causes something which is called sweat dermatitis. Sometimes certain fungi also play important role in causing this sweat dermatitis, which means after you get that broken barrier, so if you get that macerated skin, if the skin goes away, your barrier, your defense is broken. So that's when you get the infection as well as the secondary superadded infection. So because of all these things, sweat dermatitis is one of the most common skin problem that I've been seeing throughout during this lockdown. And while I was actually making this video, I got a call from one of my patients. I'm actually saying the truth. I got a call from one of my patients actually now complaining about sweat dermatitis. And today morning, I just got a patient who came and asking for a direct consultation, because I usually am doing online consultation. So the patient was like, ma'am, please, it's like burning, it's itching, I'm not able to do anything. I've just come all over from, I've taken an e-pass and I've come all over to get this treated, and it's not just going away. So that severe is the sweat dermatitis. Sometimes it can become so severe as to disrupt your sleep as well. So what do we do regarding the sweat dermatitis? Number one, wear cotton clothing. See, I'm wearing this because I'm in the AC, so I can wear this here, but not in my kitchen. So I have, you need to wear cotton, pure cotton nightie or pure cotton clothing, which is loose and it's not very tight, not very much adherent to your skin. And always don't keep your body wet. That is, when you come after a bath, take a cold water bath. Pat your skin dry, don't rub it. Take a nice cold water bath. Come out, and your room, preferably once you step out of the shower, it should have AC or fan or both. Okay, and once you step out, if at all you have the sweat dermatitis, then you can take some nice ice cubes and roll it under a good quality cotton cloth, and you can just pat them there, right? So nothing hi-fi, you can just use your own good quality drinking water and make the ice out of it, and you can use that to just give a gentle pat and keep yourself soothing and calm your skin and in the inflammation as well. And secondarily, if you have the sweat dermatitis, after doing this, you just take a liquid lotion based calamine, not something which has liquid paraffin or moisturizers. You choose something which is water based calamine. If at all you have the sweat dermatitis in a very closed area, like in your armpits or the folded places, usually the most common area we get sweat dermatitis is the back of your neck, the nape of your neck, the front of your chest, the underarms, okay, and under your breasts, especially females who have very sagging breasts. Sweat dermatitis most commonly occurs there, and also between your thighs. So these are all the most common areas where people get the sweat rash or sweat dermatitis. So you just apply the lotion, and when you apply the lotion, pat it. You gotta just pat it, not rub it at all, okay? And pat it and leave it to dry at least for 3 to 4 minutes, and then you can don your clothing. So once all that is over, at least every 2 hours once, please be in the AC, or if you are able to be in the under the fan or under the AC, that's well and good. If at all, especially females who are into cooking in the kitchen for a long time and you're profusely sweating, I would suggest you to tie your hair up, okay, as into a long bun or a high bun or something, so that your hair doesn't fall on your shoulders. That's the most common area and the most common reason why we get sweat dermatitis. All that oil from the scalp and the hair, it occludes, and then you get a lot of sweating here, and then you start getting sweat dermatitis more in that area. So either get a bob cut, or if you're afraid to go to the salons, totally understand, so just put it up as a knot. One thing. And number 2, always have a clean cotton kerchief. Don't rub it like the sweat. Don't do this. So just go ahead and just pat it. And if at all your cooking is done, make sure you do your cooking at least before 10 o'clock in the morning. If not possible, I totally understand. And if not possible, just take a break every 1 hour and stay in the AC or under the fan for at least 10 minutes. Okay. And the calamine lotion, when you apply, it should be fluidy, watery, liquidy, and you have to pat it, right? So do it 2 to 3 times a day. If at all your sweat dermatitis is too high, it's too irritating, or it's burning or very red or etc., or you think it has got secondarily infected, if at all you get any pus points or anything, any pain or tenderness in that area would suggest that it's got infected. So in those situations, please go meet your doctor, not just the medical shop guy, okay? So just go and meet your doctor and ask them what to do, and definitely your doctor will be suggesting, the dermatologist will be suggesting you what to use. And maybe we might require some mild anti-inflammatory lotions and creams, and that will settle the issue. But it's all in your hands. 70 to 80% is in your hands, and just 10 to 20% is the medicines and all that, and another 10% is your lifestyle modification.